So we had a pretty extensive team at Hopkins, and basically they had expertise in a couple areas, and I'm very glad that Dr. Hirzy already went through risk assessment because I'm the community outreach coordinator and did a lot of the community health assessment, but we also had risk assessors, and we also had people who did some spatial and statistical analysis. So basically, well, I'll go through briefly, it has our approach here. Okay, so what we did, and this was back in 2007, and just to kind of give you the background, we actually got a contract with the DC Department of Health to do the study. And we were contracted, it was a one-year contract to do a public health scoping study. And basically we looked at all of the different studies that had already been done and all the different agencies that had been involved and looked at all of the data that was available. And then we did some risk assessment to characterize potential risk to the Spring Valley community. We wanted to identify where there were some information gaps and then provide recommendations for where we thought there might be more further study. Okay. So what our approach was, it's basically 4 parts. So outreach to stakeholders, which again I was saying we worked a lot with the community and the other agencies involved. We looked at all the different studies that were done, and then we did exposure and health analysis. So in particular we looked at community health status. We did an epidemiological and toxicological literature review. We did some spatial analysis. And then basically really pulled all of that together to assess what are the health risks to the community and then put that all into a report with recommendations. So our framework here was, if you look, we started out sort of at the green part of the circle where we looked at is the hazards, what was in the ground and how do we characterize those hazards. Then the purple is, what were people exposed to? And spatial analysis where we looked geographically where certain areas in the community had more risk than others. And then ultimately what we were all really concerned about is this brown here, is what is the health status and what is the risk to the community. So that was our whole framework there. So just to give you a brief summary, and then if people have more questions, and I also, you should have a copy of our executive summary. What we found when we looked at the health was that when we looked overall, community health here in Spring Valley was good compared to the nation. We looked at mortality rates and then specifically at cancer. And we did not find an association between DC cancer registry cases and boundaries of interest. And when I say boundaries of interest, it's like the certain areas that people had looked at and where there was areas of concern. But a caveat here, which is what we recommended for further study, was we only had limited DC cancer data just based on the data that we were able to look at. I think it was there was 2 periods, 1994 to 1999, and then like 1999 to 2004. So it was obviously a short time period that we looked at. And then the environment findings, basically we found there was sort of a dual nature of contamination. So you had the dispersed low-level areas, which was basically throughout the community, and then obviously the high level where you had the pits or higher levels that were found. And then what we said was we supported ongoing sampling and remediation efforts. And we also reaffirmed what some of the previous reports had recommended from the Agency for Toxic Substances and Disease Registry. They had also done some health studies here. And the mayor had had a science advisory board. So we reaffirmed what they had said. And so we made some specific recommendations, but I guess maybe I should just talk about our next steps and then maybe if you all have more questions. But so our next steps are, we're hoping there has been apparently some money that was, and you all might know more about this than me, there was some money designated by the DC City Council for us to do some follow-up of our study of what we recommended. So far we have not actually received the money, or we don't have an official contract yet. We did finally get in touch with the District Department of Environment this week about whether we were going to be able to have a contract for a new study, and they said that we will. But so far we don't have anything signed yet. And ideally, if we do move forward, we would work also with the Department of Health to be able to get additional health data. Then we would follow up on what we recommended in our 2007 study, and then building on that work, we really, since 2007, obviously just this past week, there's been new finds here and additional information. There's also been drinking, I guess there's a monitoring well here, but there's data now that was not available when we did our study. So we want to look at all of that other information. And then clearly, as I was saying, I knew we need to outreach to university members and other input from community members based on what their concerns are. There's a question, I know, Michael, in your question guide about the anecdotal reports and things, and I just wanted to kind of mention that in our study team, we really spent a lot of time doing community outreach, and I always feel like it's so important to listen to the people that are here in terms of what are their concerns and what are their issues. And even if it's not scientific evidence, for example, or if any of the cases haven't been verified, that it's important information to get because the people living here know the area better than anybody else. And what we tried to do in our first study was take those anecdotal reports and then look at the scientific literature and see, and there was a lot of information in terms of what diseases of concern, but there was crossover in what we found in the literature versus what people anecdotally were saying. So that then led us to our recommendations that we needed to look into this further and do some case verification, look at these issues in further depth, try to get additional data on the health records here from further back if possible. And that's, I think, my brief summary. If anybody has specific, yes?
What about the part of comparing our community to another community for cancer, for arsenic-related cancer?
Yeah, thank you.
Why did you mention that?
I should have mentioned that. I'm sorry. I was just trying to be quick because I knew we were trying to keep time. So in our health findings, when I was talking about the cancer rates and things, there was, it is in my longer slideshow, so thank you for bringing it up. We did look at a community of comparison. What we picked as a comparison was Chevy Chase, DC, and there is some information in our study and in my larger slides. If you want, I can pull it up. But where we looked at the demographics of those two areas are fairly comparable. Chevy Chase is a little bit older than Spring Valley, but in terms of education, income, ethnicity, makeup, and things are fairly similar. And in that comparison, in the cancer data, we did find that Spring Valley had, so even though Spring Valley had lower rates than the U.S. Overall, that they did have slightly higher rates in some of those cancer areas of concern than Chevy Chase. Now,